Imagine waking up to a world that changed overnight. Streets empty, hospitals full, fear spreading faster than the virus itself. COVID-19 wasn't just a health crisis, it was a global shockwave. And today we are taking you on the journey to see how it unfolded. Not through speculation, not through opinion, but through real data.
Imagine this, the world is still grappling with the pandemic and equitable access to vaccines remains a top priority. Pfizer, at the forefront of vaccine development, needs our expertise to understand the current landscape and predict future trends. We are experts, analyzing the provided data to uncover the insights about vaccine effectiveness in preventing deaths and new cases. When COVID-19 first hit, we saw localized outbreaks in China, Italy, and the United States. But soon, those numbers skyrocketed. The virus knew no borders. Today, we are analyzing two critical data sets, cases and deaths. These numbers reveal not just the crisis, but also the impact of policies, response, and ultimately human resilience.
As we stand here in 2020, looking at the data, trends and industry shifts, we must consider what future holds, particularly in 2024, from way ahead around 4 years. Based on trajectory we observed so far, we can anticipate several key trends shaping the industry in the next few years. In the current growth trend continues, we expect to see massive increases in reported cases over the next 3 years, reaching a potential peak in 2023. However, beyond that, 2024 may make a turning point. There are strong indications that the case numbers could start to decline, possibly due to policy shifts, technology advancements, improved solutions, or reduced public urgency.
In 2020, we saw 233 million deaths worldwide from COVID-19. The following year, in 2021, that number jumped to 899 million deaths. The rise in death closely followed the peaks in case numbers. But something changed. If we look at the case fatality rate, also known as the CFR, we see a decline. In 2020, the CFR was at 3%, meaning 3 out of every 100 infections result in death. By 2021, that number gladly dropped to about 2%. This is a turning point. While cases were increasing dramatically, deaths were not rising at the same rate. This means that something was working to reduce mortality. But what was it? Was it improvement treatment, better hospital responses, or was it a game-changing factor that reduced its severity? That we will uncover next. First, for a better understanding, let's compare Germany and India. The blue graph is Germany and the orange graph is India. As you can see, Germany is getting hit well later than India with high numbers. Also, as you can see, India has a higher rate in death and cases than Germany. Germany has a well-structured healthcare system and early vacation rollout, keeping death rates lower despite high cases. Meanwhile, India's Delta wave overwhelmed hospitals, resulting in tragic loss of life.
We have planned to present this data in person, but like so many moments during this pandemic, COVID-19 had other plans. So here we are, virtually connected. So now, let's recap what we have uncovered. Here, vaccines have been the game changer. We saw how they slashed deaths, turning the tide in this global crisis, from over 200 million deaths in 2021 to just 49 million by 2024. Vaccines help slowly the rise in deaths as intakes increase. The key takeaway? Vaccines were not just important, they were crucial in reducing deaths. Now, let's look at how vaccination rates and deaths counts varied across countries. We cluster our information into two. Our first cluster, in blue, is showing us low vaccination rates, with 241 million deaths. Our second cluster, in yellow, is showing us high vaccinations, with 795 million deaths. What does it tell us? Early on, more deaths in highly vaccinated countries hit before rollouts. By 2023 to 2024, fewer deaths proving vaccines' long-term impact. The key takeaway, it wasn't just about having vaccines, it was about who got them first. Now let's look at how different regions uncover and what that means for future distribution. Let's zoom first into Europe. With high vaccination rates and 259 million recovers. Then we have Western Pacific with, let me show you here, with moderate vaccinations and 434 recoveries. Now let's see Africa. We low vaccinations and just 25 million recoveries. The insights, vaccines made a huge difference by timing access and public health strategies were just as crucial. Let's look ahead and what's the next for Pfizer?
COVID-19 has completely changed the way we thought we knew the world. We're seeing lives lost at mass scale. We're seeing healthcare systems actually failing. And we're asking ourselves, does the vaccine rollout timing really matter? From the data I have here, I see that the rollout timing does matter. We see that countries that have a higher percentage of vaccinated population have a low number of global death rate. And this is seen as in Portugal, the percentage of people vaccinated is 83%, and the death rate is lower than the global average, which is 7,900. We see the same for Denmark, that has an above average of 74% people fully vaccinated. And we see that the global average death rate is close to none. It's 444, which is very low compared to 7,900. It's conversely seen that countries with low vaccination rates have higher death rates. This is seen in Indonesia, which has a lower than 30%, which is 16% vaccination rate, and a death rate of 30,000 people average global death. That is well above 7,000. We see the same for India, which is below 30%, with 15% people vaccinated, fully vaccinated, and the global average deaths is crazily 150,000. Another thing we've noticed from our data is whether adopting the vaccine early or late, if it actually shows in the global death rate, does it show that there's an improvement if they adopt it early as opposed to if they adopt it late? And we see that countries like China that adopted it early, they have a global average death rate of 130 people, as opposed to the average, which is 7,900 that we saw. We see countries like Canada having 899. But when we look at countries that adopted it late, like South Africa, we see 30,000. And then we see Brazil having 200,000. And countries with delayed vaccinations was probably because of weaker healthcare responses, and this made them end up with a global average higher mortality rate. And these countries struggle to keep the deaths under control because of the bad healthcare systems that we see that they might have compared to first world countries. And our takeaway here is that countries with higher vaccination rates and that adopt the vaccination early end up having lower death rates. And there was a vaccination supply hesitancy and delay in, and this delayed the number of deaths. And yes, so what we want to say is that for the future, from all that data that we've analyzed, we see that countries that vaccinate early will stay below the global mortality average. And then that late adopters will have higher prolonged mortality rates. We also see that healthcare preparedness and vaccine accessibility plays a crucial role. Our recommendation is that you as Pfizer need to invest in public awareness to combat vaccine hesitancy, because people actually don't want to get vaccinated. And that leads to the spread of this very rapid virus. And we want to also say that using real-time data to inform the public on like news channels will make them actually know how much weight they need to put on their effort to try and stop the spread of COVID-19. So we all know that everyone number in our data set, it's a life, there's a family, it's a community. And while the worst of the pandemic has happened and the worst might be behind us, we are not done. The work is not done. And Pfizer has all the tools and the responsibility to help the public to close these gaps of the mortality rate and people who are actually getting healthcare help and facilities, good infrastructure in healthcare facilities. So we would like to urge you to work with us and get back to work because the world still needs us to come through for them.